Hi, my name's Blake Tatafu. I'm a Wiradjuri Dunghutti man from Western Sydney, and I'm here to talk to you about the Australian, Aboriginal and Torres Strait Islander Health Survey, which was run by the Australian Bureau of Statistics. Our people experience poor health outcomes at higher rates and at younger ages than non-Indigenous people. The Australian Government is committed to closing the gaps in health outcomes, and the survey provides important information to help achieve this. About 13,000 people were surveyed in communities and areas in metropolitan, regional and remote parts of Australia. If you were chosen, it means that you're representing not just people in your immediate community and area, but also people who live in similar areas to you. Some of the information collected was personal or sensitive, but don't worry, everything collected by the ABS is kept confidential and can't be used to identify individuals or communities. It also means no one outside the ABS will ever see anyone else's health information, including other government agencies like Housing or Centrelink, researchers or marketing companies.
Hi there, my name is Dr. Dana Slape. I'm a Larrakia woman and I work at a hospital in Western Sydney. The ABS recently ran the biggest ever health survey for Aboriginal and Torres Strait Islander people. You and your family may even have been a part of this, and if you were, we want to thank you for your contribution. Now that the results are in, we want to share the story with you, as the information gained is not just for the government, but it's for our people too. We can all use it to make good decisions about our health and our future. The survey collected lots of information about people's health, like how healthy do we feel, how many of us have a health condition like kidney disease or heart disease, and are our kids eating well and are they eating the right kinds of foods. All the data comes together to give us a big picture of our health, which tells us a lot of interesting things. 3 in 4 of our people said that they were in good health, very good health, or even excellent health. It also tells us what sorts of foods we eat and how much exercise we're getting, plus how things like smoking and drinking affect our health. It's good to know that fewer of our people are smoking than ever before, and the number of people smoking every day has gone down over the last 10 years. Even better, more and more of our kids are choosing not to smoke. Around 4 in 5 teenagers between 15 and 17 have never ever smoked, which is the best since the recording started. If you want to quit smoking, you can talk to your doctor, pop into your AMS or your local health clinic, or speak to the Quit line on 137848 and ask to speak to an Aboriginal or Torres Strait Islander counsellor. It's great to see our kids are eating plenty of fruit, but we also need to get them eating more veggies too. A healthy weight helps us live longer and get more out of life. Giving kids healthy food gives them the best possible start right from the beginning. Eating nutritious food improves every part of our health and reduces the chance of us getting things like heart disease, diabetes, and even some kinds of cancer. The story about heart disease tells us that cholesterol and blood pressure checks are really important. Without these checks, you might not know that you're at risk of having early heart disease. Around 1 in 4 of our people will have high blood pressure or high cholesterol by the age of 35 years old. But by the age of 45, that's really as high as 1 in 3. What's scary too is that 9 out of 10 people didn't even know they had high cholesterol. So that's why regular health checks are so important. Checking blood pressure and cholesterol helps doctors and health workers to manage your health and to prevent other conditions. Have all the adults in your family had their blood pressure and cholesterol checked? Now, let's look at kidney disease. Most people don't even know they're at risk. Around 1 in 10 people show signs of kidney disease by the age of 35 years. By the age of 55, it's as high as 1 in 4 of us. 9 out of 10 people at risk of kidney disease didn't even know it. So regular health checks are important for everybody, even the little ones. Drinking plenty of water, instead of the soft drink or juice, helps to keep your kidneys nice and healthy. When you look after your kidneys, they help you to feel good and to stay really strong. Finally, let's look at diabetes. Our people are over 3 times as likely to have diabetes as non-Indigenous Australians. We also get diabetes at a much younger age. Diabetes puts you at risk of having a heart attack, having a stroke, or even having trouble with your vision. This survey showed that around 1 in 10 people have diabetes in our communities. Even more importantly, as many as 1 in 6 who have diabetes aren't yet aware of it. That means that there are lots of people who aren't getting the medical attention that they need. Knowing if you have diabetes helps you to manage it. Perhaps eating healthier food, doing more exercise, or popping into the clinic a little bit more often. That will keep you well and strong.
So now that we have all of the information, how is it going to be of use to us and our communities? The information is already being used to better understand what health services and programs are working and where more money and effort is needed. It's being used by organisations like the Heart Foundation and the Kidney Foundation to target health programs for our people and communities throughout Australia. More importantly, our people can use the information to help us make good decisions about our health, our future, and to make sure our kids grow up strong and happy.